So, good morning, everybody, and thank you for coming to our webinar on No One is Too Disabled to Have an Eye Test. My name is Scott Watkin. I'm Head of Engagement here at SeeAbility, and I have lived experience of having an eye condition and a learning disability.
And I'm Aylee Richmond. I'm the Senior Eye Care Advisor on the Eye Care and Vision team, and I work on the Eye Care and Vision team helping people to get more accessible eye care.
Good morning, I'm Lisa Donaldson. I'm Head of Eye Health at SeeAbility. I'm an optometrist, so I bring the perspective of somebody who's providing eye care. So hopefully between the three of us, we can look at things from different angles.
Okay, so what we're going to talk to you about today is we're going to talk to you about we're going to cover some important issues around eye care and vision. We're going to talk about the eye issues for people with learning disabilities, because that's really, really important. And we're going to tell you about what the barriers are to eye care and what reasonable adjustments you can make to make sure that you're giving a person that you support or giving the person themselves the tools to make sure they can go and get a good eye test. And we're going to help you to learn to be more eye care aware. So from all of us, we're going to give you different perspectives from a person with a learning disability and an optometrist and a supporter too. So we're going to try and give you the whole journey. Okay. So at SeeAbility, we don't underestimate people with a learning disability or the people that we support to get the right eye care. SeeAbility champions better eye care for people with learning disabilities and autism, and many of whom will have sight loss and problems with their eyes. And we think it's really important that everybody gets the support to overcome huge barriers to achieve exciting new things every day. Some of those are big, some of those are small, and but everything that everybody with a learning disability achieves is all extraordinary. I know this from my own experience of having a visual impairment and a learning disability, and and every day is achieving something very different for me. So actually, if somebody has the right eye care and vision, they can achieve the same as everybody else. So, like we said, we champion better eye care. We're tackling the health inequalities in several important ways by improving the lives of over 1,000 children in special schools with specialist sight tests and support with glasses. This is one of the biggest global studies done around eye care and vision for children.
It's the biggest.
Well, it is the biggest actually. In global study that has been done, and it's about changing the way the eye care system works through our research and campaigns, and this is about making sure that we lobby government and NHS England to make sure that everybody gets the right eye care, so everybody gets the right support to be able to see the world clearly. And we also provide expert information and advice through our free downloadable resources, which are easy read, awareness raising, and peer-to-peer education. So actually, it's about sharing experiences. It's about listening to listening and understanding what other people are going through and how they've overcome barriers as well. And we help, and so this will help us to achieve an equal right to sight for the next generation. And you can get involved with us at SeeAbility.org. So about the eye care and vision team. So we aim to transform eye care for people with learning disabilities across the country. We're only a small team, but actually we're quite effective in what we do. The eye care and vision team work with both adults and children with a learning disability. Our children in focus delivers sight tests and ongoing support with glasses in 8 special schools, and has gathered much needed evidence in influence to NHS England into providing a commitment to a fully funded specialist pathway. And we've been campaigning for that for a really, really long time, and finally we've achieved it. So that is a massive win for us, but a massive win for those children, because that means that they can see their world clearly and achieve their GCSEs and goals that they want to achieve when they're at school. We provide information and advice, training and consultancy, rehabilitation assessments, and functional vision assessments. We create easy read resources around and provide liaison with optometrists and eye clinics. So we deliver presentations, exhibit at conferences and events, and we do much, much more. And that means we come into contact with lots and lots of people who might need our support and advice. So, is this me? Okay. So this week is National Eye Health Week. So National Eye Health Week will take place from the 23rd to the 29th of September, and this promotes the importance of good eye health and the need for regular eye tests for all. And you can find out more at www.visionmatters.org.uk. So why is vision important? So we all use our eyes for everything we do. And so without our vision, we wouldn't be able to achieve everything that we want to achieve in our life. Some people rely on their vision more than others. Changes in vision will result in changes of behaviour. So that might mean that somebody might only start banging into doors or walking in, tripping over curves, or they might be very frustrated and start showing some challenging behaviour. And so it's really, really important that you get the person's eyes checked out, because that could be a factor in this. And so problems with vision can be easily overlooked or attributed to a person's learning disability or autism. Everyone should be thinking about eyes and vision. People with learning disabilities must have regular eye tests every 2 years or more often. So we know that 6 in 10 people with a learning disability will need to wear glasses, but also will need support to wear their glasses, because actually having glasses on your face is strange and can really hurt and can really feel feel like actually I don't want to have these glasses on my face, but actually those glasses are there to help that person. So actually watching a program on the TV that the person might like to watch will help that person get used to wearing their glasses.
It's a really good point, Scott, actually, because it's about people. We often think you give someone a pair of glasses and the initial reaction can be negative, and then they get put away in a drawer and it's assumed that the glasses weren't right. So yeah, that support to get used to glasses is something that's really important for eye care practitioners to be mindful of when they're supporting people, but also for carers and supporters as well as the person themselves, that it's not going to be an instant success story. It often does take quite a long time to adapt to having something on your face and having a totally different perception of the world.
Yeah. So we know that 1 in 10 adults will have serious, with a learning disability, will have serious sight problems. That is quite shocking compared to everybody who doesn't have a learning disability, who will be able to just walk into an optometrist and get the right eye care for them. So it's really, really important that the adult with a learning disability is supportive to go for their eye test. We know that children are 28 times more likely to have serious sight problems than other children without a learning disability. And again, it's about recognizing that the need that the child with a learning disability needs to go and get their eyes looked at, and we need to be making sure that we make reasonable adjustments that everybody with a learning disability, whether you're a child or an adult, gets the right eye care. And so the increase, we know that there was going to be an increase and severity in the sight loss, and because the more profound and severe your learning disability is, the higher risk you are going to have a visual impairment.
Okay, so I'm just going to give you a few more statistics, which, going back to what Scott just said about how children with a learning disability are 28 times more likely to have a problem, our work in special schools has evidence that actually they're much less likely to have received any eye care. And over 40% of children attending special schools with an average age of 11 have had no reported eye care at all. And only 10% have ever accessed community opticians. And we've got a real sort of underrepresentation of the learning disabled community in the people who are registered as sight impaired. So a shocking 1% of children in special schools actually have a vision impairment mentioned on their EHCP, when we actually know that around a third of that population should be registered as having a visual impairment. Only 7,500 of the 1 million people with learning disabilities are on the sight loss register as well. So that problem of not being recognised and highlighted as a need is going from the EHCPs, the education and healthcare plans of children, and that problem is carrying on into adulthood. So it's a real lack of awareness in that population. And yet 50% of adults with learning disabilities aren't getting a sight test in the period that they need. So we've got this double whammy of adults and children who are at a much higher risk than the rest of the population, but are much less likely to be accessing any sort of eye care.
So we're just going to talk to you a little bit about the impact of undiagnosed sight problems and what that can entail for people. So we know that people with unidentified sight loss can often have a mix of emotions, and they can really vary. Often we see people becoming very distressed and angry, and that can lead to behaviour that what you might call the challenges. And we often we kind of tend to put labels on people around challenging behaviour before really looking at all the reasons why. So often people with an undiagnosed sight loss, whether that's a need for glasses or an eye condition that's not been known, can appear quite angry, very distressed, anxious and frustrated. So we might see some lashing out, we might see some aggression, we might see some of those things towards others or towards themselves. So some people, may start to headbang the floors, the walls, they may start to try and gouge their eyes, they might rub, they might poke. There can be lots of different behaviours that people might show. We also see the other side of the spectrum, where people can become quite withdrawn and frightened. And this can lead to people becoming quite isolated, as they really don't want to go out, or they lose enjoyment in the things that they used to do. And that can be really difficult for people to go through. We also see a lot of de-skilling and demotivation. So we see people not being able to care for themselves in the same way, a lack of or a dip in independent skills as a sight or an eye condition starts to take hold. Typical example of that could be cataracts, where people may start to lose independence with cooking a meal for themselves or drinks, or may need more support and become more dependent on others. So that can be quite difficult. And people often lose motivation to do things that they used to enjoy, and that can be quite heartbreaking to see. We often see a lot of diagnostic overshadowing in the sight loss sector for people with learning disabilities. So, for example, we often hear cases of people who have been assessed for conditions like dementia, when actually a sight test has revealed a cataract. And once the cataract has been treated, the signs have kind of gone. So I think it's really important that we think sight first, what should be on the priority list to try and make sure that people are getting those regular sight tests, because often there can be things that can be treated as long as they're caught early enough. We also know that people are living longer, so they're experiencing age-related eye problems. So for example, in people with Down syndrome, we're going to see problems like cataracts at a much earlier age, and that can have some implications if people aren't looking for them. So there is a huge range and a variety of feelings, emotions and difficulties with independence that people can experience when they do have an undiagnosed sight problem.
I think the really important point there as well is so many of those things could be attributed to something else. It may not be sight, but it's just about if someone is behaving differently, think about, could it be their eyes? And that diagnostic overshadowing is vital, I think, because I've seen so many people who all of their behaviours, for example, not making eye contact, not looking up, has been put down to their autism, for example, and actually they can't see, and that's been missed. So.
Absolutely, and as Lisa said, it's really important to work out some of the behaviours, to really examine and analyse those, because in some cases people might be dismissing behaviours as part of that person's learning disability or autism, but actually it could cross over into the realms of sight loss as well. So it's important that we establish if there is a particular change in behaviour that we do think about eyes and vision.
So I was going to tell you, talking about diagnostic overshadowing, a little bit about a young man we've supported in his school. Nathaniel is profoundly deaf and has very limited verbal communication. When we met him for the first time, he was 14. He hadn't had any eye care since very early childhood. He'd had an experience of eye clinic that hadn't gone so well. And he was in a challenging behaviour class, and we had the classic scenario of being advised by his mum and his teaching staff, you won't be able to test his eyes. They were worried that he might lash out, that we wouldn't be able to get close. So we started off by just trying to familiarise ourselves with Nathaniel, just shining a light in his eye. He wasn't comfortable with us coming very close, but it soon became apparent that from shining a light in his eye, that he's very, very short-sighted. And no one knew that at all. No one had considered his vision until we went into special school and we were just offering eye tests to everybody. He's actually so short-sighted, -18, that the furthest he can see is sort of 2 or 3 centimetres in front of his nose, and beyond that is everything is blurred. If we fast forward 5 years, now he's he's got glasses. He's got 20/20 vision when we measure it, and he's learnt BSL. He's at college. He can ride a bike. He's a different person for his glasses, but he's a classic example of that diagnostic overshadowing, because all of those behaviours that were, in fact, a lot of them were related to his visual impairment. He was functionally blind for want of a pair of glasses, and a lot of those behaviours were put down to his autism, and he was assumed too disabled to be able to test. So if he hadn't had those glasses when he did, I mean, it's rotten that he had, awful that he had a whole decade without them, but his life would have continued on a very different path.
So we're going to talk to you a little bit about some of the barriers that the eye care journey entails for people with complex needs. And this is what we've kind of gained experience of over the years. I think one of the most important points is that people really just don't understand why an eye test is so important. A lot of people think, particularly those that maybe have some good communication, or even ourselves in the general public, oh, I can see okay, I must be fine. So people don't think of it as a priority. It's not something that people regularly think about doing. And I think that goes for supporters as well sometimes, that they're not always understanding the importance of a sight test, and they maybe think, well, the person will never wear glasses, so what's the point in going for a sight test? As Lisa's just described again as well about diagnostic overshadowing, we see this frequently. We also know that people find medical appointments difficult. We know that they can be difficult for people to understand. People are often fearful of pain, or they might have had a previous poor experience, and it's not something that they are comfortable with. So we need to look at ways to try and make that process easier for people. Often poor advocacy can be a factor. We do hear stories from optometrists quite frequently of people being supported to an eye test with a member of staff that perhaps has only met the person for half an hour that day as an agency member of staff or a new member of staff. They don't seem to understand that it's important that that person is with somebody that knows them really well, that is able to answer questions, that is able to participate in elements of that sight test. We also know that from talking to people with learning disabilities and their supporters that often there's some poor testing methods in the eye care sector where people or eye care professionals don't always understand the needs of people with learning disabilities. And we know that there's a lack of time. If you've had an eye test yourself, you'll know that it will be around 15, 20 minutes. And for some people to try and complete all the elements of that sight test is really quite impossible. We know that there are communication difficulties during the sight test. We know that there's difficulties with how people might interact with one another, and we are expecting somebody with complex needs to interact with a complete stranger. So often that can be really difficult. We know that there's problems understanding and sharing the results of an eye test. Often people will come out with a prescription and there's numbers on it and nobody really understands what that means unless you're the optometrist. So we need to look at ways of making that easier. Access to glasses, I think, is a really big issue that we're seeing quite a lot. From the supporter's perspective, they may feel that that person will never wear glasses, they're likely to break them, there's no point in them being prescribed. But from the optometrist's point of view, it's important that they are giving that person an opportunity to try and use their glasses so that they can see clearly. As Lisa said before, it often takes a lot of work to help somebody feel comfortable with wearing them, and we need to certainly do some more work around this. We know that people may be scared of an eye test for some of the reasons that we talked about earlier, and also if somebody does have an eye problem that perhaps can't be treated, trying to be referred on to the appropriate services. Often they are referred to the learning disability team, for example, rather than the sensory team because of the learning disability, when in fact they often need quite specialist support around their vision. So some reasonable adjustments, some things that people can do to try and make that easier. So from the person's perspective, it's quite important to ask for a longer appointment or more than one appointment. So perhaps people can have multiple appointments counting as the same sight test. This would have to be agreed with the practice, but it's certainly worth asking. to visit the optometry practice or the eye clinic if necessary before the appointment. Try and help people become more familiar with that environment. Asking for a quiet waiting area or if in the eye clinic to be seen first on the list, try to minimise the time that people could become anxious. And if people need glasses, it's also so important to ensure that those glasses are fitted by a dispensing optician, a qualified dispensing optician, because sometimes as well-meaning as the optical assistants are in the practice, people with learning disabilities often need a greater level of skill in fitting glasses. So that's quite an important point.
Yeah, and it's interesting to note that there is the fitting of glasses was deregulated quite a few years back, but for children and for people who are registered as having a visual impairment, there's still a legal requirement that they're fitted by a qualified professional. So I think that's something you can ask for to Absolutely. Make sure that their glasses are the best fit they can be, because as we said, that's really going to support them in adapting to them.
Absolutely. And asking for an easy read report after the eye test. We have resources available on our website. There's a link just on the slide there that you can use, and this helps to give the person and the supporter a bit more information about what happened at the sight test, and it can be really useful for someone's health action plan. So moving on, these are some reasonable adjustments from the carer's perspective. So I think it's really important that a carer or a supporter knows what a good sight test looks like, because often we go into these appointments not really knowing what to expect. And we know that somebody might have part of a sight test, but then we still tick the box to say that person has had a sight test. But if there were tests that couldn't be completed for any reason, that does need to be documented and the person taken back, or an alternative method be sought to try and get the full range of tests completed. So I think that's quite important. And I think preparation is key. It's helping that person prepare for a sight test. So again, practicing visiting the optician, perhaps at home, maybe covering each eye, trying to get used to some of the processes that an optician might use. And also coming very close, because the optician will need to come so close to a person to look into the back of their eyes. So if we can help people become more familiar with those things, it should make it easier all round. There is also a form that we can use for giving to the optometrist called Telling the Optometrist About Me, and this gives essential information to the optometrist about a person's eye health history. It's an easy read, it's tick box, it doesn't take 2 minutes to fill in, and I think the optometrist would find it very valuable.
It is very, very useful when someone comes with that. The other thing that's really useful is, if you can do it, is a functional visual assessment. That would be that's a huge help. So if you come along having tried to tease out some of those behaviours and whether you feel they might be vision related, and so we have a resource on our website as well, which is a functional visual assessment you can download, where you can go through a number of questions. And obviously we'll be meeting someone as the eye care professional for a much shorter window than the carer. So if you can come along armed with that, it can be massively helpful.
Absolutely. If anyone would like to know more about functional vision assessment, do contact us, because we can talk you through it. And finally, in terms of reasonable adjustments, we're thinking about the professionals working in the eye care sector with these ones. So Lisa's going to tell you about these.
So again, it's about, as Aylee said, from the carer's perspective, considering, even if it's not asked for, giving longer appointments and perhaps more than one appointment. It's also, again, same thing, advising about coming along to the practice. Often the staff in reception can be key. If they're aware of people having a learning disability, they can say, "Oh, pop in and see us," especially if you're nearby. You can come in and you can have a look at the frames and things in the practice beforehand and just acclimatise to the environment. In terms of adapting the eye test, there's an awful lot we can do. We can use lots of different techniques, testing methods, to make it as accessible as possible. And as we said before, it can often feel quite frightening and threatening. So the sort of most basic things are explaining everything carefully, ensuring that you've got consent for what you're doing every step of the way. And something that I find very useful is demonstrating every step of the way. So often carer or supporter who attends with someone gets a pretend eye test before every element of the test for the person who is actually receiving the eye care, and so they can see what's up next, and that can be really helpful. The other thing that we can do as eye care providers is provide that useful information. So like Aylee said, rather than those lines of numbers that mean nothing, we can actually give someone a report which explains in plain English what the impact of having those glasses are, the impact of someone's visual disabilities will be on their ability to function. So for example, do they need to have adjustments put in place to support them day to day? What are they likely to be able to do or not do with the level of vision that they have? And we also can signpost to resources that illustrate, for example, the size of font that someone might need, and if they do have a visual impairment. So all of that's really, really important. Something else that I think can really help is if, as an eye care professional, when we find a spectacle prescription, for example, for the first time, we can easily demonstrate by just holding up lenses the impact of that spectacle prescription to the person who needs the glasses. And often that can be a game changer for the supporter. If they see just how blurry their world is without the glasses, it can be a really good incentive to understand why it's so important to use those glasses. On that note as well, I think it's important for us as eye care professionals to explain why, when we're doing an eye test, we can do it very differently. So the eye test that a carer might have experienced is sitting down very still, reading down a letter chart, see if you can read the bottom line, and then does it look better or worse with these very slightly different lenses held up. That's why people think someone's too disabled to have an eye test, because they think they can't access that eye test. So we need to get that message out there that it's very different, that we can actually prescribe a pair of glasses just from shining a light in somebody's eye from arm's length. So it's not a guess either, because I think there's, you often hear people say, we tried the glasses but they didn't work, as if, there's just a generic set of glasses that you might prescribe to see if they work for people. Actually, it's a physical function of your eye, it's a measurement, and we can prescribe really accurately from those measurements. So explaining all of that goes a long way to getting carers and the people who you want to improve the vision of on board with what you're trying to achieve. So again, those reasonable adjustments and alternative testing methods, we've got lots of different ways of measuring visual acuity as well. So that's how small you can see. So it's not just letters. We can do it with pictures. We can do it with gratings, which are choosing between a plain picture and one that's got little stripes on it. So there's lots of different ways of measuring. I think another really important reasonable adjustment on the journey is, we talked before about the dispensing optician and asking for a dispensing optician. Traditionally, the dispensing optician will fit a pair of glasses and then the patient will be on their way. Something that we advocate and something that we do routinely in our school service is we actually make a follow-up appointment with the dispensing optician. So a month or so after you've been fitted with that pair of glasses, I want you to pop back in and we'll see how you're getting on. And that gives you a chance to reinforce the messages from the eye test, to reinforce perhaps to the carer if they feel the glasses haven't been working, this is what they do. And also to see, maybe those glasses are being rejected because they're rubbing behind the ears or they're falling down and they're really annoying. So making sure that fit's just right. So again, as we've said, absolutely no one is too disabled to have an eye test. There's elements of it that we may need to adapt. We may not be able to measure someone's level of vision using the existing tests that we clinically have available, but we can always, from our children's data of seeing over 1,000 children, all but one of the children who had cataracts, we were able to look to see whether or not they needed glasses. And that child with cataracts, we were able to refer to get that sorted out. So everyone, we're able to measure a spectacle prescription if it's needed. So we're not guessing. Another really key message, which even for the eye care professional world, it's important to get out there, is even if you do have a visual impairment, whether that's due to an eye condition or to do with problems that mean that you struggle to process your vision, which is something called cerebral visual impairment. Even if you have visual impairment, glasses can still help, other than in cases of the most profound impairment. So if you think about it, it may be that your vision isn't going to come up to 20/20 to perfect, but it is still going to be better if you can have a clearly focused image. So it's still really important to support people with visual impairment to wear a spectacle correction if it's needed.
So the eye care journey for people with learning disabilities, we know that many people with learning disabilities miss out on parts of the eye care journey. So we want to talk it through with you today. So we've mentioned some of this already to you, but it's no harm in telling you it again and reinforcing the message. So the first thing we need to make sure that you are aware of is whether you're a professional, whether you're a person with a learning disability, or whether you're a family member or a carer. You need to be aware of the person's vision. You need to be aware of what they can see. You need to make sure that you need to make sure that you know that what they can see, whether at home or whether they're out they're out and about. And if you're not aware of what the person can see, you need to go and you should observe that person and to actually ask them what they can see.
I think Scott's passing his eye test here, reading the slide, because he's absolutely tiny. I'm struggling.
So the second thing is about getting regular eye tests. So everybody with a learning disability, whether you're an adult or a child, you need to have an eye test every 2 years or more often. Now, we said that the optometrist or optician, whatever you want to call them, it's up to you.
Something else as well, if you like.
You just need they can make a reasonable adjustment to see that person, and preparing for that optician's appointment is key. So using our telling the optometrist form and asking the optometrist or optician to fill out the results of my eye test form afterwards will really help that person personally. And then it's about the person might need to be able to you might need to wear the right glasses for the right job. So some people might go to the opticians, they might not need to have glasses, and then their vision might be perfectly fine. But most people who go will need some kind of prescription in their life to wear the right glasses for the right job. And so a person with a learning disability, whether you're an adult or a child, will need that support to wear those glasses, because glasses can feel heavy, strange on your face. So actually it's getting the right support to make sure that the glasses fit comfortable on your face. So that's really, really important. And you as carers and professionals need to support that person at home. It's at home to wear those to support. Keep my teeth in my mouth. Get the support to give the person the support to wear the right glasses, for them, and to help them see their world clearly. Because actually, the optician will not be in the person's house every day, every minute of their life. So actually, you have a responsibility. And then finally, it's about getting the right support. So whether people who have eye conditions, it's about understanding what those eye conditions are. If the person needs easy read information about that eye condition, and may need somebody to talk through their eye condition with them. So it's really important that the person understands what that eye condition is and why they have that eye condition. People who need eye surgery might need a visit to the ward beforehand, might need reasonable adjustments made. Some eye surgery is done in a day, but for many people with learning disabilities need a reasonable adjustment and might need to stay overnight in hospital.
They might need a general anaesthetic instead of a local, or steroid injections instead of drops.
Yes,
like
so it's really important that we get the right reasonable adjustment. And actually, some of that might be about saying to the consultant, who might say, oh, that person can't cope with this eye surgery. It's too difficult. It's the person's not going to be able to cope with the aftercare. But that's absolutely rubbish, because with the right support, the person can have the right eye surgery. And you can also fill out our eye surgery support plan, which is downloadable off our website. And then the person might need to be registered sight impaired, or blind or partially sighted, and I can never remember the correct terms for that, but
doesn't matter. The point is, not enough people are.
But not enough people with learning disabilities are, and actually they might need a rehabilitation worker to come out and give them the right support to get the right to help them to be able to live independently.
So it's asking the eye clinic about that registration, and often be how you can access that support for rehabilitation or rehab.
And the other thing about that is that most sensory impairment teams will say, well, that person has a learning disability, so why do they need the support from us when they have a social worker? But actually, these people are specialised rehabilitation workers for the visually impaired, so they're able to help and make sure the person can live independently.
Okay, so I'm just going to run through some of the things that SeeAbility are doing to help some of these issues. So as we've talked around all the way through today, we do have a variety of easy read resources on eye care issues, which are freely available to download from our website. We also have created a searchable database of optometrists. So this is a database that's on our website, where optometrists have registered their details with us and given us an idea of the facilities they might offer. So that might mean practice visits, as in going to practice the sight test at the practice. They may also have alternative testing methods like K-pictures rather than just using the Stellar chart. It'll tell you a bit about disabled parking, the size of the consultant room, things like that. So it's really useful. You just pop in your postcode or the area you live in, and you should have a list come up. They might not be the ones just down the road from you. You may have to do a bit of travel, but hopefully they should be a bit more experienced. But I would always recommend calling the practice to check that they can meet the person's needs. We have also recently launched our really ambitious lottery-funded project called Everyday in Focus, where we have now recruited 7 eye care champions in London and the northwest of the country, who are a great addition to our team, and they all have a variety of lived experience of either sight loss, autism, or learning disability, and they're relatively new in post, so we're hoping to create more roles in the coming years as well throughout the country to help deliver those essential eye care messages.
Our Children in Focus project, as Scott said earlier, is the biggest global study of the eye care needs of children who attend special schools. In order to find that out and to evidence that to NHS England, we've worked in a number of schools in London and in Durham and Manchester as well. And we've published the findings of that work to provide evidence, which has resulted in NHS England committing to developing a national scheme so that all children who attend special schools will receive eye care and spectacle supply if they need them in their special schools. And Public Health England now are signposting to that pathway too. So we're looking to those services to start to get rolled out next year in 2020. They've also committed to dental and hearing checks in special schools as well. So that's an exciting impact of our work in the schools, that we've affected that national change.
So we now have a short film for you. I wonder if it's going to work. Okay, I hope you all enjoyed that film there. That was just a brief story just about one of the children that we've supported in special schools and how the programme has made a difference to his life. Okay, so some of our resources are available, as we said before, on our website. So there's a range of things that you can look at. We have lots of forms, we have lots of fact sheets, ranging from issues on eye health to eye conditions to sight testing to eye surgery. So do take an opportunity to have a look at those and feel free to use them. Just moving on. We also have a fantastic new book available, which Scott is going to tell you a bit more about.
So I was very lucky to be part of helping to co-author in this book about looking after my eyes, and this is about two stories. One about going to the opticians and getting a sight test, and the other one's about having eye surgery, and so it's really great that now we have this resource that people can look at this book and read in group sessions and describe those pictures, and so it's really good that it's really good that we have this resource. So actually a big thank you and shout out goes to Baroness Sheila Hollings and the Books Beyond Words team to help us to be able to get this book published.
And we also have a new guide coming out with Public Health England, which is all going to be about reasonable adjustments in eye care for people with learning disabilities. It's not available just yet, but it should be coming soon. So we'll keep you posted on developments with that. And do keep in touch. We'd love to hear from you. We have a newsletter that you can sign up to. The link is on the slide just on your screens. And you would receive regular updates and developments on our exciting eye care work. So we'd love to have you on board. And if you would like further information about the Special School Site Testing Programme, please feel free to contact Richard Everett, who is the Programme Manager for NHS England at Dental and Optical Services. He's really keen to help get this off the ground. So, I'm sure Richard would be able to help you with some inquiries as well. Here's our contact details. So it's been lovely to talk to you all this morning, and we are hoping that you might have some questions for us.
Can I just add as well that if there's any optometrists or dispensing opticians listening in, we have got CET accreditation, that's continuing education and training accreditation. Just drop me an email and we can then get you a point for listening to the webinar, and that applies if you listen after when it's recorded as well. Any questions? Okay. I will take this opportunity to say something that we haven't mentioned as well, which is just to flag to everybody that another really key one of our messages, which is that one of the leading cause of avoidable sight loss worldwide is actually uncorrected refractive error, which basically means needing glasses and not having them. So I always ask that question to audiences, and I usually get the response of, is it glaucoma, is it cataracts, but it's actually glasses.
Okay, we've got some questions coming through. So first of all, I'd just like to respond to Mary. I'm really glad you found this useful for your son. So please feel free to contact us again if you need any sort of further information. Annie, please do feel free to ask us a question. We'd love to hear that. And Tanya, yes, I think that Rachel from Learning Disability England will be sending round the presentation. If not, then we will be, so that's absolutely fine. So we'll just see whether we can get a question from Annie, but do feel free to type us a question.
I have allowed some of the speak requests that have been put in, but the programme is sometimes a little bit funny, so it might be easier to type it if it's not obvious on your screen now and you've requested to speak.
Okay, so Tanya, sounds great for children in school with the continuing support. Is there anything similar to follow for adults? Well, that's a very good question, yeah. Tanya, very good. I'm going to let Lisa answer that one.
Yeah, I mean, NHS England, we have always been lobbying them about the whole population, because obviously we've got children attending special schools, we've also got children who attend mainstream schools with learning disabilities, and we've got the entire adult population. So NHS England have promised that this is the start of the programme, and they do promise to put things in place for adults. Currently, we've got some piecemeal services, so across Greater Manchester, Durham, Darlington and Tees, Sutton and Bexley, CCGs, so local teams,
Barking and
Dagenham, sorry, local CCGs, so local services have been commissioned, but it is just across that. Have I missed anywhere else out?
Cheshire and Merseyside.
Cheshire and Merseyside, thank you. Across those areas, we have got local services commission, which basically means that the practices have to do some extra training and they get some extra reimbursement to be specialist services for people with learning disabilities to have their eye test. But we'd love to see something like that happening nationally.
Absolutely. I've just seen we have a question from Annie. You'd like to know a bit more about reasonable adjustments for adults with complex needs, so profound multiple learning disabilities. I think, Annie, there's a problem with the sound. I think Rachel was just saying. So would you like to type your question and we'll see if we can answer that for you? Okay, so again, sorry, just while Annie's is typing away, Tanya is just asking anything we could do locally to push things forward in Devon. Lisa, what do you think?
Write your MP is always a really good one. Just if you've experienced, there's a recent, if you write to us, write your MP. If you've got experience of issues in access, then please let us know. The more evidence we have that people aren't always accessing the eye care that they're entitled to, that really helps us to push things forward. And writing to your MP with those experiences at the same time is a massive help too.
Okay, that's great. Thanks, Lisa. So I can't see any more update from Annie, so I think we'll just try and answer the question about reasonable adjustments as best as we can there. So for adults with really profound needs, I think it's just important to find, I think in some cases a domiciliary site test may be more appropriate, so for people to be tested at home, that can be sometimes quite helpful. Again, use our database to try and to find an optometrist maybe with a little bit more experience. I think it's also important to try and prepare the person as far as possible. So that might mean that might mean doing a functional vision assessment. So as we mentioned in the presentation, we do have a tool on our website which you can use, which is really quite straightforward to use. It's a list of things that you can simply observe about somebody's behaviour. You can make some observations about the appearance of their eyes. And then there's some little tasks that you can do to try and test some of the theories. So I would really recommend a functional vision assessment for somebody with very profound needs. And I think just splitting the sight test down into manageable chunks is often really helpful for people, because for people that do have those very complex needs, they can often get really tired, or they may, be at risk of having seizures. And again, if they are struggling with the parts of the sight test, it's simply just to try again another day. I think that's really, really important. So, but I hope that helps, Annie. I could just see a comment from you that you're shut out of the meeting, so you can't hear now. So I'm really sorry that's happened, but I hope that maybe you did get to hear some of that response there. And Amanda, thank you so much for tuning in. I'm glad that you'll be sharing this with your organisation, and please do let us know if there is any other questions or any inquiries that you'd like us to answer. Is there any other questions from anybody? Okay, thank you so much for joining us all today. We hope you've enjoyed this morning's webinar, but do feel free to... Oh, sorry, we have one more question. So from Tanya, I'll see if we could sneak that one in there. What is the criteria for registering as having a visual impairment, and what are the benefits? This is relating to my 14-year-old son. Okay, so Lisa, do you want to take that one?
Yeah, so you need to be registered by an ophthalmologist, which is a medical practitioner, so in the eye clinic in the hospital. The criteria are based upon that Snellen chart, so if you can't see the top letter very broadly, but there's much debate around cerebral visual impairment. If you have a hemianopia where you can't see to one side, then you can be registered. But it's complicated, and so it's probably good if you need advice about your son's specific case, then do get in touch. But yeah, it's down to the ophthalmologist ultimately. But some people who can't read letters, it becomes harder for the ophthalmologist to follow the strict guidelines for registration, and it is up to their professional judgment as to whether they register people. Interestingly, no children get registered in Scotland, for example. So registration is, in children particularly, the rules aren't set in stone, because obviously if they can't read letters, then those rules can't be applied stringently.
Okay, thank you so much, everybody. So I could just, Annie, I can see your question about the sight loss register, and I hope Lisa's just answered that one for you as well. But if you do have more questions, again, you can contact us individually, and we can email you or phone you.
I was just going to add that when you get registered, the two categories are sight impaired and severely sight impaired. Most people still have some sight, but the registration process involves being issued with a certificate of visual impairment, which is often called a CVI form. So that's what you'd need to be asking about with regard to registration.
That's great, thank you. Okay, so I could just see we have a question from Katharina. So you came in late. So the beginning of the webinar, I'm hoping that the slides can be sent round. Oh, but it's been recorded. I know that. So I'm hoping that Rachel from Learning Disability England would be able to forward that on to you. So I hope that's okay. I hope we've answered everybody's questions, but if we haven't, or you'd like to know more information, then do feel free to contact us on the contact details on your last slide. And I'd just like to take this opportunity to say thank you very much for joining us this morning, and we hope you enjoyed the session. Thank you.
Thank you very much.
Thanks